What if you woke up tomorrow and found out that the NHS would no longer be treating 36 common conditions? Sounds unbelievable, right? Well, it's happening. In 2025, a major shift is taking place in the UK healthcare system, one that could impact you, your family, and millions of others. But what exactly does this mean for you? David here, and today we're diving into a controversial new NHS policy that has raised eyebrows and sparked debate across the country. This isn't just about a few minor cuts to services, it's about conditions many of us deal with every day, no longer being covered by the NHS prescription plan. From the cold sore that keeps returning to the dandruff that seems impossible to shake, these everyday health problems are no longer being treated with a prescription. You might be asking yourself, how could something so common no longer be available through the NHS? And more importantly, what will this mean for your health and well-being moving forward? In the next few minutes, we'll uncover the real reasons behind these cuts and what they mean for your access to treatment. Is this a necessary step towards a more sustainable NHS, or will it create more problems than it solves? Could this lead to bigger changes down the line, or is this just the beginning of even more exclusions? Stay tuned, because I'm about to reveal everything you need to know about the 2025 NHS prescription cuts. Plus, I'll share some important tips on how to manage these conditions without relying on prescriptions. It's crucial information for you to know, especially if you're someone who has been relying on the NHS for these common treatments. Before we jump in, make sure to hit that like button, share this video with your friends, and subscribe to the channel so you don't miss any of the latest updates that matter most to you. Let's get into it. As we look into the sweeping changes the NHS is undergoing in 2025, many questions arise about how these alterations will affect everyday people, especially seniors. The decision to cut prescriptions for 36 common conditions has left many people wondering, what does this mean for them? Will they still have access to the treatments they rely on? And most importantly, how can they manage their health without the aid of the NHS for certain conditions? Let's take a closer look at the policy and what it means for you and your family. To understand why the NHS made this decision, we need to look at the bigger picture. The NHS, as the backbone of public health in the UK, has always faced financial pressures. With the increasing cost of healthcare services and a growing population, maintaining financial sustainability is more important than ever. By removing prescriptions for conditions that are often self-limiting or can be treated with over-the-counter medication, the NHS aims to direct its resources toward more critical, life-saving treatments. In theory, this should allow for a more focused and efficient healthcare system. However, the practical implications of this decision are what have caused significant concern among many. Conditions such as dandruff, minor burns, cold sores, and mild migraines will no longer be treated with NHS prescriptions. This might seem surprising to many, especially seniors who have relied on the NHS for years to help manage even minor health issues. However, these conditions are generally considered low priority when it comes to NHS funding. Many of them can be effectively managed with over-the-counter treatments, which are far less expensive and more readily available. For example, a simple dandruff shampoo or pain relief medication for a mild headache can be bought at any pharmacy without the need for a prescription. But what about those who struggle financially? The concern here is that for some people, especially those on fixed incomes, even small costs can add up. If someone can no longer rely on free NHS prescriptions for something like a mild infection or a minor skin condition, they might have to pay for these treatments out of pocket. This could create an additional financial burden on people who may already be struggling to make ends meet. For seniors, in particular, who often live on limited budgets, the idea of having to pay for basic health needs could be a daunting prospect. Many advocacy groups have already voiced their concerns about the impact this could have on low-income individuals and families, who may find themselves unable to afford essential over-the-counter remedies. Another aspect to consider is the impact on vulnerable populations, including seniors with multiple health conditions. While it might seem straightforward to manage a minor health issue like a sore throat or mild skin irritation, for seniors with complex health needs, even these seemingly minor issues can become more difficult to handle. For example, someone who is elderly or has a weakened immune system might be more susceptible to complications from conditions like a simple cold or a mild skin infection. The new policy could inadvertently put them at greater risk if they are unable to access the treatments they need when they need them. It's also worth noting that some of the conditions removed from the NHS prescription list are quite common. Cold sores, for instance, affect millions of people each year, and while they are generally not serious, they can be incredibly uncomfortable and unsightly. For many people, the NHS prescription for cold sore treatments has been a reliable and affordable option. With the new policy, people will need to seek out alternative treatments which may not always be as effective or affordable. Similarly, conditions like mild eczema, hay fever, and even minor wounds will no longer be treated with NHS prescriptions, leaving individuals to manage these issues on their own. So, what does this mean for you, as someone who may be affected by these changes? First and foremost, it's important to understand that while the NHS will no longer provide prescriptions for certain conditions, it doesn't mean that you have no options. In fact, many of these conditions can be effectively managed with over-the-counter treatments, which are often less expensive than prescription medications. For example, antihistamines for hay fever, hydrocortisone cream for eczema, and even over-the-counter painkillers for headaches and minor aches are all available without a prescription. These medications can be purchased from pharmacies, supermarkets, or even convenience stores, giving you more control over your healthcare needs. However, just because these treatments are available without a prescription doesn't mean that you should go into managing your health blindly. It's important to be informed about what's available and how to use these products safely. For example, if you suffer from mild acne, over-the-counter creams and gels can be effective, but it's essential to choose one that's suited for your skin type. Similarly, if you're dealing with persistent heartburn or indigestion, there are a number of over-the-counter antacids that can provide relief. But if these conditions don't improve, or if they become more severe, it's important to seek medical advice. As a senior, it's also crucial to maintain a good relationship with your pharmacist. Pharmacists are now being given more responsibility in the healthcare system, and many of them are trained to provide advice on minor ailments. If you're unsure about which over-the-counter treatment is best for your condition, don't hesitate to ask your pharmacist for guidance. They can help you make an informed decision and ensure that you're using the right products for your specific needs. In addition to relying on over-the-counter treatments and seeking advice from your pharmacist, it may be helpful to establish a regular health routine. For example, if you suffer from seasonal allergies or dry skin, you might want to keep a small stock of essential products at home, such as antihistamines or moisturizing creams. This way, you can stay on top of your health without needing to constantly visit the doctor for prescriptions. For conditions like mild headaches, back pain, or sore throats, consider using over-the-counter remedies to manage symptoms before they escalate. One thing to keep in mind is that the NHS is still committed to providing care for more serious conditions, such as cancer treatment, cardiovascular care, and mental health services. The goal of these prescription cuts is not to reduce the quality of care for people who need it most, but to redirect funds toward treatments that have a more significant impact on health outcomes. By focusing on these critical areas, the NHS hopes to improve its overall efficiency and sustainability in the long term. That said, it's essential to remember that while these changes may seem challenging, they also represent a shift toward more self-managed care. The NHS is encouraging patients to take greater responsibility for managing their health, and many seniors may find this approach to be empowering. By making use of available resources, including over-the-counter treatments and the advice of healthcare professionals, seniors can continue to manage their health effectively without relying on prescriptions for every ailment. In conclusion, the 2025 NHS prescription cuts are a significant change in the way healthcare is delivered in the UK. While these cuts may initially seem concerning, it's important to recognise that they are part of a broader strategy to ensure that the NHS can continue to provide high-quality care for those who need it most. By taking proactive steps to manage minor health issues and seeking advice from healthcare professionals, seniors can continue to live healthy and fulfilling lives. As always, staying informed and being prepared is the key to navigating these changes successfully. So, stay informed, stay healthy, and don't hesitate to seek the support you need to manage your health.